Hi everybody, this video today is just to show you the new functionality in Health One around the COVID-19 booster vaccine. So we get straight to it and I'll open up a test patient. So I'm in my patient selector, you're all very familiar with that. And I'll just search for my patient. In my example, in my test system, I have a vaccine patient in here and we'll use John Test for this demonstration. So I'll double click on John Test. And it opens up John Test's file. And we can see over here from underneath the medical chapter that John Test had 2 vaccinations. He had his first dose in April and his second dose in July. So what we'll do now is we'll give him the booster or the shot 3 for the immunocompromised, depending on which is relevant to him. So I'll show you how to do both. So we begin by, as we would always, we insert a transaction. We click on our little icon to insert a transaction and we choose the vaccine. So we have the vaccine name here and we leave everything else as it is, today's date, and we press OK. And in my case here, in my system, I have a sequence against my vaccination transaction type. So I'll automatically put in this vaccine here, but I'll just delete that for today's demonstration. Because what we'll be doing is we'll be using this icon up here, the COVID vaccine. So you can see when we hover over it, it says insert COVID vaccine. So we click on that and it just tells me, it's just confirming the 3rd dose here and it's telling me when the 2nd dose was given. And it's asking me, please confirm you are registering either a booster, a shot 3 for the immunocompromised. So we're going to pick either one of those there. So they both work. I'm not going to go through both. They both do exactly the same. They work the same from here. It will just depend on which one is relevant for that patient. So I'll use this shot 3 for this example and we'll press OK. And the next thing that pops up is the list of the different types of vaccines. So in this example here, we'll use Pfizer today, but you also have your Moderna down there. And if I needed to add new batch numbers in, I could click on my 3 little dots there, as you would do for any vaccine. And I would click my plus there and I would add my batch number and my expiry date and the number of that particular vaccine I would have there. In this case, I won't add any new batches in, but that's where you do it from there. I'll just let it choose the batch that's in there and I'll press OK. And again, I'm going to choose, I'll choose say this one down here and we'll press OK. And the rest of it's kind of the very same as it was before almost. So we have the COVID vaccination dialog box that pops up. So you'll all be really familiar with this. In my example here, I'm in a test system. So my test patient hasn't got a valid PPSN number in. If he did have a valid PPSN number, it would have automatically populated in there. But for demonstration today, I'll just choose unknown because I'm in a test system. And I'll just say I wish to proceed without electronic payment. Everything else has automatically populated and it's pulling it from the last vaccine. So it's pulled in all the information again. So if anything has changed, I could change it in here if I needed to. The only slight difference with the booster is the patient eligibility questions have slightly changed in some cases. So depending on what you choose here will depend on what happens next. So if I was to say yes there, you know, I'm prompted here to say I'm not eligible for the vaccination. Depending on which one you choose there, if I say yes there, you can see there it's giving me this option. You are eligible, however, you should be observed for 30 minutes post-vaccination. So we leave them all as no for now, but you can, you know, you'll choose your questions based on the correct criteria. And we'll press next here. And we're into our vaccination, the second part of our vaccination. So this is the vaccinator details. So the first part there in the other screen was the actual GP or doctor who has the GMS number. This is who's actually administering the vaccine in here. So this may be the nurse. You may select the nurse from here. We leave all that as it is. We have our batch number. It's pulled the batch number based on the batch I selected in the first screen. The name of the vaccine, the manufacturer, the injection site is red, so it means I need to input that in. So I'm going to say left arm, and all the rest of it is pulled in automatically. And then the injection number, because I chose dose 3 at the beginning, it's automatically ticked that. Had I chose booster, it would have ticked that booster there. I can put a comment in and I could submit it as I would have done before. In this case, I'll just do save form and submit later. And I'll leave that in there. So you can see what it has done in there. It's put a history into the patient file of the vaccine they were given and the date it was given on, and the usual information. Exactly same as it was for giving the shot 1 or the shot 2. So that hasn't really changed. The only real difference is at the very beginning when you input the insert COVID vaccine, you now get a pop-up asking you which one you want to give at that point. So that's really the only difference and the slight change in the patient eligibility questions. And the only other thing I'll show you in here is under the dashboard. So under analysis, and we have the COVID-19 vaccination dashboard. Again, you're probably all really familiar with this, but just to say that we have a new filter in here, dose number. So because I'm in a test system, obviously I don't have any data in my system. But if you came in here, if you unticked your period here, you'd see all your patients in here. So everybody who's got the vaccine. And what you could do is you could say, just show me everybody who's got dose 2. So if I was to choose dose 2 there, what I would get there is a list of everybody who's had their second dose. And I could go as far as choosing the patient age. So I could say, show me everybody over the age of 80, and I could filter it down in that way. And from that, you can see there that you get the mobile phone number on that list. So you could print that list off and phone the patients to invite them in for their booster or their third shot, whatever is applicable to them. Or you could export the list and get somebody else to do that by clicking the export there. So that's really all. Any questions, feel free to email me. My email address is glenda.o'neill@clanwilliamhealth.com. And yeah, that's everything. Thanks for watching.